Normal development of sensory motor skills. For 37 to 40 weeks of gestation or birth, for gross motor coordination, they can move their entire body into extension, turn their head side to side, and keeps head mostly side while in supine position. For their fine motor coordination, they can visually regard objects and people. They tend to fist and flex hands across the chest. They display diminishing grasp reflex and involuntary releases after grasp. 1 to 2 months. For gross motor coordination, they can practice extension and flexion. Head control begins, and when held in standing position, they can bear some weight on legs. For their fine motor coordination, they can display diminishing grasp reflex and involuntarily releases after grasp. 3 to 5 months. For gross motor coordination, they can support self on extended arms while in prone position, prop self on forearms. They have more balance between extension and flexion position, and they can bring hand to feet and feet to mouth while in supine position. For their fine motor coordination, they can constantly bring hand to mouth. They can develop tactile awareness in hands, and they can reach more accurately with both hands. 6 months. Gross motor coordination. They have complete head control. They can sit alone, and they begin assuming quadruped position. For fine motor coordination, they can shift weight and reaches with one hand while in prone position. They can reach to be picked up and begin to hold objects in one hand. 7 to 9 months. Gross motor coordination. They can shift weight and reaches while in quadruped position. They creep. They develop extension, flexion, and rotation movements, and increases number of activities that can be accomplished while seated. For fine motor coordination, they can transfer objects from one hand to another. They can reach with supination and uses the index finger to poke objects. To 12 months. Gross motor coordination. They can stand independently. They begin to walk independently, and they can pull to standing position using legs only. For fine motor coordination, they can use 3-jaw chuck grasp, superior pincer grasp with fingertip and thumb, and display controlled release into large containers. 13 to 18 months. Gross motor coordination. They can walk alone. They seldom fall, and they squat and stands back. For fine motor coordination, they display more precise grasping abilities. They precisely releases objects into small containers, and they can isolate index finger to point at objects. 19 to 24 months. Gross motor coordination. They display equilibrium reactions while walking. They can run using a narrower base of support, but they fall easily. For fine motor coordination, they use finger-to-palm translation of small objects. They can build block tower using 3 to 4 blocks. 24 to 36 months. Gross motor coordination. They can jump with both feet, climb up the stairs, and they can kick a ball. For fine motor coordination, They uses palm to finger and finger to palm translation of small objects. They display a complex rotation of small objects and shifts small objects using palmar stabilization. They can scribble and snip with scissors. Normal development of sensorimotor, oral, and feeding skills. Birth or 37 to 40 weeks of gestation. For sensorimotor, they can move total body into extension or flexion. They can lie on stomach, turns head side to side, and they can lie on back, head turned to side. For oral motor, they possess strong gag reflex. They possess autonomic phasic bite release pattern, and they possess rooting reflex. For feeding, they begin bottle or breastfeeding with real sucking pattern. They use a mixture of suckling and sucking on bottle, depending on the head position. And they possess incomplete lip closure. 1 to 2 months. Sensorimotor. They continue to gain control of head. They experience weakening grasp reflex and do not possess voluntary release skills. For oral motor, they continue to show strong gag reflex, continue to show rooting reflex, and they continue to suck and suckle when hand or object comes in contact with mouth. For feeding, they may open their mouth and wait for food. They have a better lip closure and uses active lip movement when sucking. 3 to 5 months. Sensorimotor. They can constantly bring hand to mouth. They have good head control, and they can develop tactile awareness in hands. For oral motor, they have diminished strong gag reflex at 5 months. They drool less in positions with greater postural stability, and they use his mouth to explore objects. For feeding, they loses liquid from lip corners. They are able to receive solid food from a spoon at 5 months, and they demonstrate voluntary control of mouth during bottle or breastfeeding. 6 months. Sensorimotor. They reach to be picked up. They begin to use thumb and grasp, and begins to hold objects in one hand. For oral motor, they experience decrease in the strength of gag reflex. They maintain lip closure longer on back, stomach, and in sitting position. And they drool when babbling, reaching, and teething drools less during feeding. Feeding, they suckle liquid from a cup with liquid loss. They gag on new textures and begins finger feeding. 7 to 9 months. Sensorimotor. They can creep on hands and knees. They shift weight and reaches on hands and knees, and uses index finger to poke. For oral motor, they use facial expressions to convey likes and dislikes. They bite on fingers and objects to reduce teething discomfort, and uses mouth, visual examination, and hand manipulation to investigate new objects. For feeding, they suckle liquid in a cup, but loses liquid when cup is removed. They take fewer sucks and suckles before pulling away from cup to breathe, and they can independently hold bottle. 10 to 12 months. Sensorimotor. They can stand independently. They learn to walk independently, and they smoothly releases large objects. For oral motor, they can produce more coordinated jaw, tongue, and lip movements when sitting, standing, and creeping on hands and knees. For feeding, they use controlled, sustained biting motion on soft foods. They can chew with mixture of up and down and diagonal rotary movements. And they like to feed self but needs assistance with using spoon. Invert spoon before putting in mouth. 13 to 18 months. Sensorimotor. They can walk alone. They learn to go up and down the stairs with assistance, and they have more precise grasp and release. For oral motor, they move their upper and lower lips. By 15 months, they have excellent coordination of sucking, swallowing, and breathing. For feeding, they uses an up and down suckling pattern to obtain liquid from a cup, and they show well-coordinated rotary chewing movement by 18 months. They also have smooth biting movements. 19 to 24 months. Sensorimotor. They demonstrate equilibrium reactions while standing and walking. They run with narrower base of support. For oral motor, they uses up and down tongue movements of tip elevation. They can develop internal jaw stabilization and swallows with easy lip closure. For feeding, they can efficiently drink from a cup and able to grade jaw opening and closing. 24 to 36 months. Sensorimotor. They can jump in place, pedal a tricycle, scribble, and snip with scissors. Oral motor. They uses tongue humping rather than tongue protrusion to initiate swallow. For feeding, they possess circular rotary jaw movements. They closes their lips while chewing and holds cup in one hand. Developmental sequence for self-care skills. Age 1. Dressing and undressing skills. They can cooperate in dressing, like holding foot up for shoe or sock. They can hold arms out for sleeves. They pushes arms through sleeves and legs through pants. For grooming and hygiene, they can cooperate during hand washing and drying, and they have regular bowel movements. For age 1.5, dressing and undressing skills, they can partially pull shirt overhead, unties shoes, or takes off hat as an act of undressing, and they can take off loose clothing such as mittens, hat, socks, and shoes. Grooming and hygiene, they allow teeth to be brushed, they pay attention to toileting, and indicates discomfort from soiled areas. Age 2. Dressing and undressing. They can remove unfastened coat. They helps pull down pants and finds armholes in a pull-on shirt. For grooming and hygiene, they attempt to brush their teeth in imitation of adults. They wash his own hands with assistance and shows interest in self-washing in bath or shower. Age 2.5. Dressing and undressing. They can assist in putting on socks. They put on front button type coat or shirt. They unbutton large buttons, and they can remove pull-down pants or shorts with elastic waist. For grooming and hygiene, they can dry their hands. If prompted, they can wipe their nose if given a tissue, and they have daytime control of bowel or bladder, and they experience occasional accidents. Age 3. Dressing and undressing. They can put on over-the-head shirt. They can put on shoes, excluding fastening, but it may be on the wrong feet. They can also put socks on with some difficulty in positioning the heel. For grooming and hygiene, they can wash, rinse, dry the hands. They use the toothbrush with assistance, and they can independently get a drink from fountain or faucet. Age 3.5. Dressing and undressing. They can unzip front zipper on jacket, separating the zipper. They can put on the mittens and unbuckle belt or shoe. For grooming and hygiene, they can pour well from a small pitcher. They can spread soft butter with a knife. Age 4. Dressing and undressing. They can put on or take off pullover garments. They can put on socks with appropriate heel placement, and they can also put on shoes with assistance in tying laces. For grooming and hygiene, they can brush their teeth with supervision. They wash, rinses, and dries body with supervision, and they can complete all toilet hygiene tasks. Age 4.5. Dressing and undressing. They can put belt in loops. For grooming and hygiene, they can wash and dry hands and face without assistance. They can brush or comb their hair, but not including the tangles. They can tear toilet tissue and flushes toilet after use. Age 5. Dressing and undressing. They can take off or put on a pullover shirt correctly each time. They can lace their shoes, and they can dress unsupervised. For grooming and hygiene, they can scrub their fingernails with brush with coaching. They brushes or combs their hair, not including the tangles. They can cut soft foods with a knife and blows nose independently when prompted. Age 5.5. Dressing and undressing. They can close back zipper. They can zip coat zipper, inserting zipper, and they can tie and untie knots. For grooming and hygiene, they can perform toileting activities, including flushing toilet, independently. Age 6. Dressing and undressing. They can tie a bow knot. They can tie hood strings. They can button back buttons. And they can independently complete all dressing tasks, including fasteners and belts. For grooming and hygiene, they can brush and rinses independently.